Up here about what 2 hours ago. And if you missed the last discussion I had at 11 a.m., we kind of talked about just basically reaching optimal performance. So whether you're an athlete, I treat a ton of athletes, but if you're not an athlete, but if you have grandkids and you like playing with your grandkids, or if you're a weekend warrior, like to go golf, play tennis on the side, basically just everything that we could do to increase your performance capacity, it's just so you feel the best you can in your own skin. So that's what we were talking about earlier. And now we're going to dive into something that is relatively new over at the World of Wellness here. So I think it was just about a year ago we started using something called a KBMO fit test. It's a diagnostic tool to check for different food sensitivities that you have in your gut. But more importantly, what kind of separates KBMO diagnostics and their fit test from other companies is basically it can check inflammation in your gut. And then we'll kind of get into one key component that literally can measure if you have leaky gut and gut permeability. So we'll just dive right into it. So, the KBMO FIT test, what does FIT stand for? So, the FIT stands for a food inflammation test. And again, I can't stress this enough. There are a ton of different other manufacturers that check for any kind of food sensitivities. But what separates KBMO is it actually checks for the inflammation as well. So you don't have too many false positives. So we'll kind of get into that. So if you purchase or if you use a KBMO fit test, they make it pretty easy for patients. They have a fit 22, a fit 132, and a fit 176. And essentially what that means is it's either going to check 22 different foods, 132 or 176 different foods, additives and sugars and all that kind of stuff. So we will dive into that. So the food sensitivity testing measures up to 176 different foods, coloring additives with the fit test. And this was actually created by Dr. Dorval, and he was involved in creating like the first rapid HIV and AIDS testing. So he has a pretty extensive background in that. And then he kind of took his knowledge and took it over to KBMO Diagnostics, and they kind of developed an inflammatory food panel. And so this was patented. This is actually the first assay to identify IgG 1 through 4, which is the food sensitivity aspect component, and then the C3D inflammation marker simultaneously. So that is a specific complement protein. And what separates again KBMO diagnostics from other ones is that since you have the C3D, that complement protein, it increases the reliability of the test, so you don't have any false positives. um and how that works is basically, so say I went out tonight, I went to dinner and I was drinking a ton of wine, maybe a little too much wine, more than I was supposed to have. If I took my KBMO fit test tomorrow, more than likely I would have like a reaction to grapes. So that's checking the sensitivity, but again, the C3D checking the inflammatory portion as well just kind of rules out any kind of false positive. And there's it's basically a multiple pathway approach because you're looking at the two different ones, and there is a difference between the sensitivity and the inflammation. um, and then just a couple, just a little bit of a background. So, like a food allergy compared to a sensitivity. So, food allergy, you're gonna have an instant symptom. So that's a specific cause and effect. So, for example, I went out and I had shrimp and I felt like my lips kind of blew up; they got inflamed. Or if I ate a banana and then all of a sudden my throat started to itch, that is a cause and effect, and that goes off of the immunoglobulin E. Food sensitivity, this is where this patients could benefit greatly from this because it's your immune system's reaction to food, and it actually can take up to 72 hours for you to produce a symptom. So that's why it's tough when patients come in and they're like, yeah, I'm trying to lose weight. I tried the keto diet, tried paleo, tried this, tried that, and then last resort they tried the elimination diet. Well, elimination diet is tough because again, it could take up to 72 hours for you to show a reaction. So it's really hard for a patient to kind of track what the heck did I eat 2 days ago, and now I'm having a reaction. I'm breaking out in hives. I'm getting more acne. My face is kind of red and inflamed. So it basically takes out the hard part of the patient to go on an elimination diet, just because it's really, really hard to track. So KBMO diagnostics makes it relatively easy. Insensitive sensitivities can come and go based on the health of your gut and your microflora and your GI system. So the the more good microbiome and bad, and the more good microbiome in your gut and the less bad bacteria in the gut, actually your sensitivity to certain foods can kind of change based on your gut health. And why this is important for patients who say, "Oh, I could eat anything. I don't really have an effect." Um, just to make it very basic and generic, you have a lining in your gut, and basically we're checking inflammation. So, say you don't have a reaction, or say you could go out to eat and you could eat anything. Mom cooks at home, your girlfriend cooks, you're eating it, you have no reaction. Um, the inflammation, chronic inflammation, and leaky gut kind of takes a long time to kind of rear its ugly head. So if you have more inflammation in your gut, it's kind of breaking down the lining, and then you're having loose junctions in your gut microvilli, and that's when you get all the bad bacteria, the viruses, and then everything negative kind of happens. So when patients say, "Yeah, I could eat anything. I don't really have an adverse effect from anything," over time that will break down the lining in your gut, and then it'll be more permeable, and then bad things can happen. So, what the KBMO diagnostic fit test looks at, basically three elements in one test. So, we're looking at the food sensitivity with the patented IgG 1 through 4. We're looking at gut inflammation, again, with those complement proteins. And then we're looking at gut permeability. So, this is one of the only tests that can actually check if you have leaky gut. And basically, the main three things you're looking for gut permeability is, if on your panel, say you do the Fit 176, if you have 10 or more foods elevated on your panel, that's going to trigger to look for the leaky gut. Same with elevating candida, and then the big one is the zonulin. Zonulin actually checks for leaky gut, and so we'll kind of go into it right now. Why is that important? Zonulin is a protein that is synthesized in the intestinal cells and liver cells, and it's the key biomarker for any kind of like intestinal permeability. So that's absolutely massive, and I believe they actually added this into their tests. Once they created it, I think this is one of the ones that they added. And why this is important is the only regulator of intestinal permeability that is reversible, hence the leaky gut. So the zonulin component to this test is absolutely massive. And we were talking about leaky gut, right? So healthy gut, you have your tight junctions. So when you have the tight junctions, it's hard for bad bacteria, viruses, gluten, toxins to kind of pass into the microvilli. But when you actually have leaky gut, so say you have a ton of inflammation in your gut, those tight junctions become loosed and the villi are damaged, and that's when you have all the bad pathology occur, when you have the bad bacteria popping in there, the viruses, toxins, and so on and so forth. So essentially, checking for leaky gut is absolutely massive when it comes to, obviously, if you have any kind of GI distress. But more importantly, the more we learn, and it seems like every month they're coming out with talking about how vital the gut is. Roughly 80% of your immune system is stored in your gut. So if you're chronically getting sick, if you have any kind of like brain fog, just generally chronically fatigued, it's pretty darn important that you actually look into the gut, just because they're now calling your gut your second brain. So if you have terrible gut health, that's going to affect everything systemically, your whole body. All right. And getting more, diving a little bit deeper into the leaky gut here. Um, Elevated levels of zonulin are actually associated with autoimmune stuff. So, like when we're talking about celiac disease, MS, and other chronic illnesses. So, how we were just talking about how roughly 80% of your immune system stored in your gut. Currently treating symptoms of a patient. One has SLE, so lupus, two MS, and two Parkinson's. Like currently, the past couple weeks I've been treating, and not only are we getting them right in the room chiropractically, and kind of just working on what some of their symptoms and their ailments, we're taking a big dive and diving deep into the gut, just because once you heal the gut, your immune system's naturally going to get a little bit better as well, and then your autoimmune condition is going to kind of suppress. And actually, my MS patient that I'm treating right now, we are actually doing high dose vitamin D3 therapy coupled with K2. She got diagnosed with MS in 2014, and she has been in remission since 2017, based on what she does for her gut health. And I'm going to bring Joe Messino up here to talk about a couple supplements, and the high dose vitamin D3 coupled with the K2. So just to kind of dive into that when we're talking autoimmune, specifically MS. Um, when you go for lab work and you get your vitamin D checked, the reference range is anywhere from 30 to 100, which is absolutely ridiculous. That is a massive range, and it's crazy because people, I ask them when they come in, "Hey, did you get lab work recently?" "Yeah, sure, I'll bring it in." They bring it in, and their vitamin D level is like 34, and they're like, "Yeah, my doc said that's okay. That's a green light." Not necessarily whatsoever. In my opinion, I think your vitamin D should be anywhere from like 70 to 85 or 90. And this patient that I'm treating right now, I'm actually working with her MD out in Arizona, and we'll jump on a couple calls, and she's actually taking very very high dose vitamin D therapy. She actually started at 100,000 IU's a day, and now she's at 50,000 IU's a day. And everybody says, "Doc, that's scary. What about vitamin D toxicity?" Understand the question. Here's how you combat that. There's something called K2, and the most absorbable form of K2 is MK7. And so we could think of K2 as kind of like a quarterback in the system. So it is going to take the vitamin D out of your blood serum and actually deposit it where it needs to go in your body. So, can you run a risk of kidney stones and vitamin D toxicity without taking K2? Yes, but Nutritional Frontiers makes it very easy. We have our Super K2 Plus, which is basically your recommended daily value of 5,000 IU's of vitamin D3. And then it has the correct ratio of the K2, and we carry the most absorbable form of MK7. And the ratio is right, so you don't run the risk of developing kidney stones or any kind of vitamin D toxicity. So, that was just kind of a side note with the vitamin D therapy and the autoimmune. But again, it stems back to the gut. So if you don't heal your gut properly, your autoimmune condition is just going to run rampant in your body, and then you're going to get a ton of adverse symptoms and reactions there. All right. So when we talk about diet and supplementation changes, over the counter supplements may contain terrible ingredients such as aspartame, polysorbate 80, yellow 5, yellow 6. And this is kind of funny, the Centrum multivitamin. I think it was a Porta-John company, if I'm my understanding. They were cleaning out Porta-Johns, and they actually contacted Centrum because people were taking the Centrum Silver multivitamin. They were literally finding those, like when they were cleaning the Porta-Johns, like literally the Centrum multivitamin with the C on it. So you're literally not getting anything from it. And it's so funny when patients come in, that follow me from my other clinic or just, found me on social media. They see this whole store, and I was like, "Do you take a multi?" "Yeah, I can take Centrum. It's great. I feel great." You're not getting any nutritional value from that whatsoever. You're literally just getting the outer layer of it breaking down. So you're getting the stuff you don't want, like the hydrogenated oils, the yellow 4, yellow 5. You're basically essentially just getting the coating. Literally no nutritional value whatsoever. Not to knock Centrum, but that is pretty crazy if a Porta John company is literally saying that they're finding these in their Porta Johns when they're changing them out. So um, a lot of patients ask me too, "Hey, I got this test. Can I basically try and change my diet and then see how it works and without taking supplements?" My advice, no. I think you got to have both. You definitely got to change your diet for the foundation, but as I was talking about earlier, leaky gut takes a while to kind of rear its ugly head. So there's a lot of deterioration before you actually have the symptoms. So we have to take certain supplements or nutraceuticals to kind of help like kind of stop the progression of it, restore and replenish it. And then your diet, when you change your diet, that's really really going to help kind of prevent that autoimmune condition, GI distress, your brain fog come back again. So and I always tell patients, you get what you pay for. A lot of patients I ask, "Are you taking any supplements?" And they come in, "Yeah, I'm taking magnesium." "Okay, where'd you get your magnesium?" "I got it off of Amazon." And they say, "All right, we'll bring it in." And they bring in magnesium oxide, and they're like, "Yeah, I thought I might as well just try this because this was like $10 on Amazon." You truly get what you pay for. Nutritional Frontiers, we have the Mag Complete 300. And when people come in and they say they're taking a magnesium oxide, that's actually not even that absorbable by your body. It's poorly absorbable. So my pecking order, the one I like is magnesium glycinate, highly absorbable by the body. It's going to help with anxiety, depression. It'll help your sleep. And then the other forms of magnesium I like as well is magnesium threonate. That's actually shown to cross the blood-brain barrier, and it actually helps with like cognitive function. And then the other one, the magnesium citrate, that is kind of for like bone health, and that could actually also act as a laxative effect as well as your body. So you truly get what you pay for. Can you buy a magnesium supplement on Amazon for $10? Yes. Are you going to absorb any of it? No, pay the extra $7 or $8 and get the Mag Complete, because we have three of the most bioavailable forms of magnesium. So you're truly, basically, like, just you're using that and you're going to absorb it. And when we get back to the diet, everybody says you are what you eat. You're not what you eat. You are what you absorb. And we have to have the necessary gut microbiome, and we have to heal and replenish your gut so you can actually absorb everything that you're trying to take in, through food and any kind of other beverages as well. So, and the other thing too is you got to look at the other ingredients. So we were talking about the Sencha multivitamin, again, not knocking them, but if you look at all the other ingredients, that's what I like about Nutritional Frontiers. Some of our products, I mean, you only see like three other added ingredients, and they're not bad for you. They're not going to harm you. Most of these other supplement companies that you could get over the counter on or off of Amazon, I mean, you're going like 10 deep, and that's all going to be inflammatory for your gut. Okay, so this is when I'm going to bring in Joe, and Joe is going to talk about, two different supplements that I love putting patients on when it comes to kind of healing leaky gut. And we're going to bring Joe in, and then we're going to talk about IgG and GI Complete. You got your mic? You want to share a mic?
I got a mic.
All righty.
Yeah. You're doing good, man.
Thank you. Appreciate
I
it.
taught this guy well.
Yeah.
He's doing good. He's doing good.
So, yeah, you could jump in, and you want to start with IgG or
Sure.
GI Complete?
Either one. Now, IgG and GI Complete, most of the time, are used together as a protocol. And you were right on the money. And the bottom line is, with the gut, you've got to do it in the right order. That's why we have a protocol for gut health, gut repair. And that means you have to first seal and heal the gut. And what that means is there's a mucosal lining that covers the entire digestive system, from your esophagus all the way down to the stomach, the small and large intestines, and out through the anus. So it's there everywhere. Any part of that can become deteriorated. Any part of that can have lesions and holes in it, to make it simple. So what you have to do is first repair that sealant, that wall, so that nutrients don't leak out and bacteria doesn't get in. Okay, so if you start just taking a lot of probiotics, well, just like you said with the multivitamin, you're not going to get any benefit if you're losing most of them.
Absolutely.
Because of the permeability of the digestive system. So with IgG, this uses a fantastic patented research ingredient called immuno
Third time's a charm.
Immunoglobulin. Wow, that didn't want to come out. Immunoglobulin. Okay. That's because we also have an ingredient called inulin, but that's different. Okay. Yeah. Immunoglobulin. Why is that important? Because this nutrient will, and like you said, it's part of the test that they do. Absolutely. Right? Yep. At KBMO. This will bind to, neutralize, and help you eliminate any foodborne bacteria that's in the gut that could be causing the deterioration of the mucosal lining to begin with.
Absolutely.
Okay.
Yep.
So it used to be, when we just had GI Complete, this is the most complete gut healing formula on the market. Uses two major healing nutrients, L-glutamine, and there's a lot of products that have L-glutamine. But if you don't have the 5 grams of L-glutamine that are in the case studies, that are in the clinical trials, you won't get that healing. Now, the second ingredient is a combination of zinc and L-carnosine, and that's called zinc carnosine. Now, this is used in many countries as the first-line defense for peptic ulcers. It's that powerful of a healing agent, and they're both in GI Complete. So when you do these together, you heal the mucosa, you eliminate the cause of the problem in the first place, the bacteria, and now you can start with phase 2, which is then repopulate. Now bring in the probiotics. Now you're going to get use from them. And then part 3 is assimilate. And as you said, it's not what you eat, but what you absorb.
Absolutely.
So the enzymes are what are going to help improve the assimilation of the micronutrients from the macronutrients that you eat.
Absolutely.
Enzymes are that important. I want to make a real quick side note about enzymes. We have a kinesiologist here, Jeff Nisnik. And so, Jeff and I both did the KBMO test. And when I was showing him my results of the test, I said, it's really weird. It's really interesting. Number one, I only had 2 out of 176 foods show up.
Dang.
Wait a minute. Get better.
Woo.
I only had 2 show up in the red.
Let me show it.
Yeah.
And I'll be honest with you guys, everybody tuning in online, that is never the case. Everybody, if you kind of look at this, so here's kind
Only
of
2.
here's kind of an overview.
Giving everybody my test results. You can't see it? No, it's too blurry. Yeah. Okay, but anyway, it's going to show you, red, orange, and yellow. This is highly sensitive, mildly, and just slightly sensitive. Now, I had 2 foods show up in the sensitive, and it was very, very unusual because one of them was spirulina.
Huh.
Spirulina. Huh. And it's in our greens, right? I mean, we're doing it. I'm doing it all the time. I'm wondering, wow, where's this bloatedness coming from? So then the other one was clams. Now, no other shellfish, huh? Yeah. No, mussels are not in there. Just clams. And in the orange, it was turkey. And in the yellow, corn, crab, bacon, and this is weird, amaranth. I don't know if I ever ate amaranth. Anyhow, okay, so I said to Jeff, this is, kind of strange, but I said, let's go through. And when Jeff does his testing, if a food comes up that you're sensitive to, he tests it then again with enzymes. So I had these sensitivities. So we started testing me with enzymes and these foods. And so with spirulina, with clam, with turkey, with crab, corn, all of them, as soon as he tried all 3 of our enzyme formulas. He tried Probzyme, Betazyme, and Cybezyme. And on all of them, Cybezyme reduced or eliminated the sensitivity. So the KBMO test is going to bring to light many of these sensitivities. Yep. But that doesn't mean you can never eat those foods again.
Exactly. It helps you understand your body and what your body will create inflammation to and what you're sensitive to. So this is a sliding scale, just how Joe was talking about how his spirulina, and as soon as he got muscle tested and he started taking an enzyme, that is going to decrease your sensitivity to it. That's so right. Then you could have it. It's not a death sentence. Like for example, my severe reaction was cow's milk. I love cheese. I don't know if I'll ever stop giving off cheese, but at least I know that my body creates inflammation to it. Right. So when I take necessary things after my gut is healed, then you could eat those, but you just don't want to go off the rails with it.
Yeah. Yep. Awesome. That's great. I mean, that's a great report too.
Not bad.
Not bad at all.
Not bad. I don't eat a lot of cod. But and it is pretty cool, guys, too. Like when we check people for this stuff, right? Just how I was speaking prior, if me and Joe went out tonight and had dinner and we had 1, 2, getting on the 3rd bottle of wine, right? Way too much wine. and if we took this, the next day, guaranteed grapes is going to come out. That we have like a reaction to it, right? But it's a sliding scale. So there's a lot of times that people will test. We get them on the GI and the gut protocol, change their diet, they tweak a couple things in their lifestyle, and then if they do another test follow-up, some of the the severe reactions, they're not even a severe reaction anymore. They might be a moderate reaction or no reaction whatsoever. So it's basically understanding what your body creates inflammation to, what it's sensitive to, and then getting on the right supplements, nutraceuticals, and the protocols, just so you don't have a significant flare or create inflammation in your gut.
And the other thing, though, as I was watching Dr. Phil and listening to him, the gut-brain connection, right, that you talk about. Now, here's the thing that most people don't realize is that, yes, a leaky gut can affect the brain. But guess what? Any head injury or trauma is going to affect the gut.
Absolutely.
Okay, so it works in both directions. And I'm sure you see a lot of athletes, that are in contact sports.
Yep.
Right?
Yep.
And it's going to affect their gut.
Yeah, absolutely. And, food for thought, when someone sustains a massive concussion, why do you think sometimes they throw up right after? So they call the gut your second brain, and not only to talk about what it does for your brain health, but again, your immune system, how much of your immune system is located in your gut?
Yes, just about all of it. And that's such a great point, but you see that a lot, I'm sure, with athletes and even anybody that has a slight head injury, they're going to experience it in the gut as well. Yep. So, and now there's what connects that I probably know you do, but what connects the brain to the gut is something called the vagus nerve. Now that's spelled Vagus, not Veg. Okay, it's not that Vegas; it's another Vegas. Okay, but with in allopathic medicine, when they see there's a problem in that connection, of course, their solution is just cut out the vagus nerve.
Yeah.
Let's not repair. Let's not fix. Let's not
Yeah.
go to the source of the problem.
Yep.
Let's resort to cut, burn, and
Yep.
poison.
Yep. And to speak to that point, autoimmune conditions, brain, and everything. My Parkinson patient I'm currently treating, he has an MD in Seattle. What did he just buy from his MD in Seattle? Something that stimulates your vagus nerve that you actually clip onto your ear. So that is massive in that protocol as well. Yep. And then going on to why would you take a KBMO fit diagnostic
you need
test?
me anymore? You got
I think
it?
we're good.
You're
Yeah.
good.
Thank you,
All
Joe.
right.
I appreciate that. Yep. So why, if you're a patient and you're listening to this, why would you want to take a fit test, like a KBMO fit test, the food inflammation test? Autoimmune disease is absolutely massive. Me and Joe were just talking about the link between autoimmune conditions and basically good microflora and GI system. Chronic migraines. If you've seen a chiropractor multiple times and you're still having migraines, you tried medication, you tried supplements, you tried different diet and exercises, but you're still having a flare up of migraines, come in and see what your body's creating, any kind of food sensitive. Well, see what's sensitive in your body, and then see what your body actually creates inflammation to. Chronic fatigue, again, gut and digestive issues, and trouble with weight loss. That's the biggest thing. Getting back to the diets, people increase their exercise regimen. So say they were exercising twice a week, now they're exercising 5 or 6 days a week. They're still not losing any weight. They tried a keto diet, paleo, they tried the carnivore, tried all these different diets, and then the toughest one is the elimination diet. Say they try the elimination diet, and again, we were talking about how you could have food sensitivity up to 72 hours when you consume a certain food. It's really, really hard for the patient to kind of zone in and say, well, shoot, I think I felt the worst off of X, Y, and Z, because it's really, really hard to track. So, the fit test makes it very, very easy to basically see what your body is going to be sensitive to and what your body is going to create inflammation to. And then we basically have a baseline, and we could get you on the correct protocol, just how Joe was talking. With the digestive enzymes, we have 3 different kinds. We have the probezyme, which is a blend of probiotics, digestive enzymes, betazyme, and the cybezyme. So we got to get you on the right protocol that's right based on your own blood. So this is a blood test based on your own lab work, and then we could kind of tweak your diet and get you on the right track with certain nutrition and basically what you could eat every day and certain supplements to take. And why I think patients would like the KBMO test, the fit test, more so than any other thing, because when I send people for blood panels to check any kind of GI stuff, and usually, so a lot of patients don't like going to get lab work. It scares them. And then as soon as you bring up, hey, let's order you a stool sample, they're like, I'm done, out the door. So this is just a very non-invasive way based on your blood to see which, again, you're sensitive to and what you create inflammation to. So if anybody has any questions about this, I'm here Monday, Tuesday, Wednesday, Friday, and some Saturdays. My lunch is from 1 to 2. Call in the front office. We'll leave your name and number, and then we could kind of talk about, if the KBMO test will be right for you, and I can answer any questions you have based on that as well. So thanks, guys, for tuning in. And then I'm going to be back on Friday at 11 and 1. At 11, we're going to be talking about the TPI, the golf certification. And then at 1, we're going to give you a demo of what we have in our recovery room, which contains the Normatec compression boots, which kind of helps with circulation, the infrared sauna, kind of detox purposes. And then we're going to talk about what the vibration therapy does for what I was talking about 2 hours ago, your proprioception, so where your body's at in space. So thanks, guys, for tuning in, and we will see you in 2 days.